Hello, my name is Dr. Jacel Brooks, and I'm a non-surgical orthopedist and sports medicine specialist. In this video today, I'm going to talk about a procedure I perform called platelet-rich plasma, or PRP. This is a procedure that is typically performed on patients with chronic tendon or ligament injuries. And the reason we use platelets is because they're the body's first mechanism of healing, and they release vital growth and healing factors to the injured areas of the body. In this video, I'm going to walk you through a typical patient encounter that describes the typical patient problem, describes a typical patient area of injection, and leads you to looking at how the procedure is done. At the end of the procedure, I'll answer some frequently asked questions about the procedure so that you may have a better understanding of what you will encounter if you decide to have this procedure performed. The first part of the procedure entails drawing blood from the patient. So here you can see us using the arm of a patient to get a vein and draw off about 20 cc's of blood from the patient to be used for the PRP procedure. Here you can see me injecting the blood that I just obtained from the patient into the tube used to be inserted in the centrifuge to be spun down to obtain the PRP. I inject the blood into the tube, then put the tube into the centrifuge where it will spin down for about 14 to 15 minutes. And after the spin down, we'll obtain the tube and draw off the PRP. Here you can see me drawing off the top yellow layer, which is mainly plasma, that's platelet poor. I will discard this, and then on the bottom layer you see this dark red purple area, which is the platelet-rich plasma, or PRP, which I will use to inject back into the patient's injured area. Here you can see me using the drawn up PRP that I will inject into the patient's injured area, as in this case a patella tendon. First, I will numb the area with about 3 to 5 cc's of lidocaine along the tract of where I will inject the PRP. I will use this under ultrasound guidance, as you can see the ultrasound screen here showing a view of the patella tendon. As I inject, I will look for my needle on the ultrasound to make sure that I'm in the right spot. As I hit the right spot, I will then inject the PRP, typically getting in the area where the patient has the most pain, but also in most cases injecting a more diffuse length or area of the injured tendon or ligament. I treat areas from the plantar fascia to the ankle tendons and ligaments to the knee tendon and ligaments, elbows, specifically the epicondyles on the medial and lateral side. I treat the shoulder around the rotator cuff, and any other chronic tendon or ligament injury in the body that's easily accessible via ultrasound and injection. The procedure is done right here in our office at North Cypress Medical Center. Time for the procedure is anywhere between 30 and 45 minutes, with 45 minutes being typical of from when you step in the door to when you actually leave the office. I perform anywhere between 1 and 2 treatments per affected area. Patients are returning to regular activity within 2 to 4 weeks, depending on the area and the size of the area injected. Say if you had an Achilles tendon injected, it's probably going to bring you more to 4 weeks versus an elbow closer to 2 to 4 weeks. I have my patients off of any anti-inflammatory medication such as Advil, Aleve, ibuprofen, aspirin, because it can have a counter effect to the process of the PRP being injected. Other than that, no other pre-procedure protocols. Right now, PRP is being used in all types of athletes, from your high school athlete to your collegiate athlete to your professional baseball, football, soccer athletes, and also in your weekend warriors or just daily average Joe recreational athletes. If you're a patient and you've been dealing with chronic tendon or ligament pain or injury for quite a while, and you've tried physical therapy, you've tried anti-inflammatory medicines, you've tried bracing or straps, and nothing's helping, then this procedure typically is right for you. If you still have questions, you can give me a call and we can set up a time to meet and talk about further discussion of the procedure. But typically you fit into that realm of patients who are quite the right fit for the procedure. I hope you find this video useful, as it may have calmed some of your fears you have about the procedure or provided the essential information you needed to have the procedure performed for that chronic tendon or ligament injury. If you have decided that the procedure is something you would like, please do not hesitate to give us a call here at Advanced Orthopedics and Sports Medicine. Thank you for your time.